I'm Tom Denwood. I'm the Vice Chair of Policy and Strategy at BCS Health, or BCS Health and Care, as you might soon be named.
What do you believe are the key challenges for creating a person-centric health and care system?
Sure, okay, well there's a few, but the first one is to really get our thinking around person-centred care, because hey, care revolves around me, you, your auntie, your grandmother, your children. It revolves around the individual. It doesn't revolve around the organisation serving them. So we've got to change our thinking and put that person at the centre of our thoughts. Secondarily, we've got to banish organisational thinking. So those overlaps or trip-ups you might have had is your information is passed from your GP practice to your hospital, or from your GP practice to your local physio. All those organisational boundaries, actually a citizen or person doesn't want to see those. They just want to see one joined up NHS. Third thing, we've really got to get to the hearts of the decision makers, because these are the people who can be empowered, certainly in organisations and at board level in an organisation, to put in the money to make those local changes necessary. Fourth thing, as a workforce, we've got to professionalise, and as informatics professionals, I think we've actually got to lead the answers and lead some of our colleagues to the answers. In many instances, they're looking to us. And then finally, we've got to have fun, whether it's via hack days or big impact events. The ways we come up with the answers to the challenging question, I think it's going to be a very interesting and fun process.
Why should I be involved?
Well, I think two reasons. The first one is to help shape the debate. And if you're like me, you might spend you do your day job, but spend your evenings and weekends kind of musing over bigger questions which impact the health and care system. And actually, this can really help you kind of work out what those questions are and actually play a role helping answer them. So because your view is probably as good as anyone's, the issues you're facing day to day will have an impact elsewhere in the system. So if you can help us work through the answers, I think the answers we'll come up with will be much, much better. And secondarily, it helps you step outside your day-to-day role. So if you do a specific thing at the moment, but your questions are about something elsewhere, this gives you the avenue and the vehicle for going out and working out what those answers are and investigating them. So.
And why do you think events like today and HC, for example, are important?
I think they're really important because it gives you the opportunity to network with like-minded colleagues. It gives you the opportunity, and I find, to kind of open up your mind, see what's going on elsewhere around the country or internationally. And then I think it gives you real kind of food for thought and reflection. And then hopefully what you learn on these events, you can take back in the workplace and hopefully nudge your day-to-day job in the direction of travel, which is better for the overall system.
Final question. Where are we at the moment with health informatics? Are we in a good place?
I think we are in a good place, but there's much to be done. So if you've seen the advances in technology and the way citizens use technology themselves, and you might have just heard my mobile phone go off with a text message, those are small examples of how citizens are using technology really readily, day-to-day basis. So we've got to make sure that the hospitals, the GP practices, not only keep up with the citizens' demands, but actually meet and then exceed their expectations. So I think we've done a great job over the last 10 years, putting the basics in place, but now's the time we need to shine and take all of that moving forward.